Hi friends, how are you? I hope all of you are safe. Okay, last class we discussed about the brain, CSF, thalamus and the hypothalamus. Today we move on to the next topic, that is epilepsy. Okay. The seizures are episodes of uncontrolled electrical disturbances in the brain that cause changes in attention or behavior, movements and level of consciousness. That is the definition of epilepsy. That means epilepsy is a neurological disorder in which the brain activity become abnormal, causing seizures. Okay, this is the definition of epilepsy. Next one is the type. It is divided into three: focal onset seizure, generalized onset seizure and unknown seizure. Focal onset seizure means what? It is referred to as partial onset seizure. From the term itself we know that it is a partial onset seizure, in that it occurs in one area of the brain. Okay, that is the focal onset seizure. Next one is the generalized onset seizure. These seizures start in both sides of the brain simultaneously. Okay, both sides of the brain simultaneously. The most common type of generalized onset seizures are tonic, clonic and atonic. Okay, generalized is divided into two, that is tonic, clonic and atonic. Tonic, clonic means what? These are also known as the grand mal seizure, which means tonic refers to muscle stiffening and clonic refers to the jerky arm and leg movements during the convulsion. Okay, tonic means it is refers to the muscle stiffening and clonic refers to the jerky arm and leg movements during the convulsion. Atonic means what? It is also known as drop seizure. Okay, it is also known as the drop seizure because it is a type of seizure that consists of partial or complete loss of muscle tone. Okay, that is known as drop seizure. It is a type of seizure that consists of partial or complete loss of muscle tone. Okay, and it lasts about 15 seconds. That is known as the atonic stage. Last one is the unknown onset seizure. Sometimes no one sees the beginning of a seizure. Unknown means what? Sometimes no one sees the beginning of a seizure. Okay, I will give you one example. Someone may awake in the middle of the night and observe that their partner having a seizure. This is known as the unknown onset seizure. Okay. Next, we move on to the phases. Okay. There are three phases: prodromal phase, aura, ictal phase and post-ictal phase. First, we move on to prodromal phase. Okay, in seizures, they take on many different forms from the beginning, prodromal stage and aura, middle, ictal phase, and the last one is the post-ictal stage. In prodromal phase, it involves mood or behavior change. Okay, in prodromal phase, it involves only mood or behavioral change that may precede a seizure by hours or days in first stage. Okay, beginning stage. Next one is the aura phase. Aura phase means what? Aura phase is that it is actually the earliest sign of seizure and the beginning of the ictal stage. Okay, it is actually the earliest sign of seizure and the beginning of the ictal stage. That means is that some people is used to describe the warning. That means they feel before they have a tonic, clonic seizure. Okay, In this oral stage means is that some people will describe the warning they feel before they have a tonic-clonic seizure. In fact, it is a focal aware seizure. Okay, aura means it is actually the earliest sign of seizure and the beginning of the ictal stage. Okay. Next one is the ictal stage. It is a seizure activity, usually musculoskeletal. Okay, musculoskeletal is involving. Last one is the post-ictal stage. It is a period of confusion, irritability that occurs after the seizures. Okay, in post-ictal stage, it's a period of confusion, irritability that occurs after the seizures. Appa question chodikkunnayanida. Period of impaired consciousness after a seizure is called what? Period of impaired consciousness after a seizure is called post-ictal stage. And DASH is a sudden abnormal electrical discharge from brain that result in changes in sensation, behavior, etc. Okay, DASH is a sudden abnormal electrical discharge from the brain that result in changes in sensation, behavior, etc. The answer is seizure. Okay, next we move on to the causes. Genetic cause. First one is the genetic cause. Second one is the brain structure abnormalities. Okay. Second one is the brain structure abnormality. That means if there is any defect present at birth. Next is the immune system abnormalities, that is related to HIV, AIDS, etc. Infectious disease, example meningitis, viral encephalitis, like that. Okay. Kidney failure, liver failure, low blood glucose level, etc. These all are the causes for the epilepsy. Okay. Next we move on to the signs and symptoms. During a seizure, a person experiences abnormal behavior, symptoms and sensation. Okay, during the seizure, the person experiences abnormal behavior, symptoms and sensation. Sometimes they may develop loss of consciousness also. In that, the person may experience both focal and generalized seizure. Okay, in the signs and symptoms, in that the patient may experience both focal and generalized seizures at the same time, or one can happen before the other. Okay, the symptoms can last from a 5 seconds to 15 minutes per episode. Okay, the symptoms may last from 5 seconds to 15 minutes per episode. That time the person may experience a sudden feeling of fear or anxiousness, a feeling of being sick to the stomach, dizziness, headache, change in vision, jerky movements of the arms and legs that may cause to drop the things, headache, etc. When the seizure progresses, the person may develop losing consciousness followed by confusion, having uncontrollable muscle spasm, drooling or frothing at the mouth, have a strange taste in mouth, clenching the teeth, biting the tongue, having sudden rapid eye movements, making unusual noises, along with that uncontrol of bladder and bowel function, having sudden mood changes, etc. Next one is the treatment. Treatment for the seizure depends upon the cause. Okay, treatment may depends upon the cause. By treating the cause of the seizure, we may be able to prevent the future seizures, including medical management and the surgical management. In that, there may be medical management and the surgical management. Medical management, in that, blood test for electrolyte imbalance, spinal tap to rule out any infection, electroencephalogram. This measures the brain waves. Next one is the CT scan, MRI scan, lumbar puncture, and the surgery to correct the brain abnormality, and all the medication. Coming to the medication, what all are the medication means it is the diazepam, Valium, sodium valproate, topiramate, carbamaxipine, acetozolamide, clonazepam, diazepam, etc. These are all the medical management. Next one is move on to the surgical management. In surgical management, there may be a resective surgery. That means there will be a temporal lobectomy is done. The most common epilepsy surgery is the removal of a small portion of the brain. In temporal lobectomy, the surgery is the removal of the small portion of the brain. Okay, the surgeon cut out the brain tissue in the area of the brain where the seizure originated. Okay, the surgeon cut the brain tissue in the area of the brain where the seizure originate, usually the site of a tumor, brain injury, or the malformation. Okay, because it may reduce the number of seizures while limiting the risk of permanent brain damage. Okay, and last one is the nursing management. Nursing management first aid means keep the other people out of the way, clear the sharp object away from the person, and don't try to stop the movements. Place the head on her side to promote the airway clearance. Don't put anything in the mouth. Okay, and the last one is to prevent the trauma and injury. Okay, that is all for today. Have a nice day. Thank you.